And now I'm going to talk about the Psychology Act, Scope of Practice, and Control Acts. I'm sorry, I have cold, but according to the plan, every Wednesday I need to do a part of the talk. This act defines what psychologists can and cannot do. Two authorized control acts communicating a diagnosis and providing psychotherapy. That is it. You cannot prescribe medication, you cannot perform surgery. The scope of practice is the assessment of behavioral and mental conditions and psychotherapy. That is your legal scope. The two controlled acts authorized to psychologists are number one, communicating a diagnosis, number two, treating by means of psychotherapy. What does communicating a diagnosis mean? Telling someone they have a specific mental disorder like major depressive disorder or generalized anxiety disorder. This is a controlled act. Only authorized professionals, psychologists, and physicians can do it. A school counselor or social worker cannot say your child has clinical depression. They can say your child shows symptoms of depression but not diagnosed. Psychotherapy is also a controlled act, defined as treating a mental disorder by psychological means, usually through verbal communication with the goal of changing maladaptive means. So, usually through verbal communication with the goal of changing maladaptive patterns. So, you can diagnose, you can provide psychotherapy, you cannot prescribe medication, order lab tests, perform surgery, or admit to hospital, though you cannot recommend. Title protection. Only members of the College of Psychologists of Ontario can call themselves psychologists or psychological associates. These titles are legally protected. Using them without registration is illegal and can result in fines or prosecution. This includes similar sounding titles like registered psychologist or anything that implies you are regulated by the college. However, therapists and counselors are not protected titles in Ontario. Anyone can use them, but that also means they do not carry the same authority. What about psychotherapists in Ontario? Registered psychotherapist is a protected title under a different college. Psychologists can use it too, but it is not required. A psychologist moves from the US to Ontario. They were licensed in New York. Can they call themselves psychologists in Ontario? No, not until registered with CPBAO. Using the title without registration is illegal. A psychology graduate student calls themselves a psychologist in training on their business card. Is that acceptable? Probably not. Avoid anything that implies you are a regulated psychologist. Use psychological associate, supervised practice. If registered in that category, a client asks you to prescribe anti-anxiety medication. What do you say? I cannot prescribe medication. That's a controlled act not authorized to psychologists. I can refer you to a psychiatrist or your family doctor. You are trained in EMDR for trauma. Is that psychotherapy? Yes. EMDR is a form of psychotherapy. You are authorized to provide it. A client asks for a diagnosis of ADHD for workplace accommodations. You have experience but not specific training in adult ADHD assessment. Can you diagnose? Only if you are competent, you can. The Psychology Act authorizes the act, but the Code of Ethics requires competence. If not competent, refer. Exceptions in emergencies, you may do what is necessary to prevent them. Thank you very much.